This is Dr. Saila. Let's talk about a common problem today, which is common cold. This podcast is on how to reduce the severity of common cold and its duration of symptoms once you notice the symptoms. For prevention of common cold, please check my previous podcast. When we get cold, we all want to be functional with less severe symptoms. Not that many of us can take a week off in this busy life. Am I right? How do you get cold? Cold comes from a virus. This virus is attached to the mucous membranes of your nose and throat. Once attached, it starts to replicate. We are all very familiar with the initial symptoms of cold, that little tickle in the throat and a funny feeling in the nose, or it could just be a sneeze. These symptoms could very well be a false alarm, could be an allergy or season change or something else, but it's better to be safe than sorry. Act on this right away to prevent impending cold from coming before the virus makes its home in your throat. If you delay, these precautions may not work that effectively, but the symptoms you get after taking these precautions are less severe and of shorter duration. Before I talk about my 10 natural tips, I want to emphasize on something. Antibiotics do not help with the virus. In fact, you will have unnecessary adverse effects when you take antibiotics. If you use them when you don't need, you will develop resistant bacteria, and they don't work when you really need these antibiotics in future. And antibiotics go and kill good bacteria in your intestines, and your body takes months to form these good bacteria back once you take a course of antibiotics. Okay, let's talk about the 10 tips. First tip, act on it immediately once you notice the symptom without any delay. This is the most important of all the tips. Second one, zinc sulfate lozenge. Recent studies found that zinc intake is associated with reduction in the severity and duration of cold symptoms in adults, but not in children. Zinc is more effective if you use it within 24 hours of onset of symptoms. It can give a bad taste or nausea, but do not use intranasal zinc. That means zinc through your nose as a nasal spray, because several reports of permanent loss of smell from using the zinc through your nose. Because of this reason, I recommend using zinc only as a lozenge. Let them dissolve in your mouth. Do not chew them. If you chew them, they'll go directly into your stomach before they act locally in your throat. Next one is salt gargling. It's considered as the safest and effective preventive measure. Make salt water by adding about 1/4 teaspoonful of sea salt with a half cup of water and gargle with about 2 tablespoons of this water every 4 hours. Next one is our grandma's home remedy, which we all know, warm vapor inhalations. Boil about 2 cups of water. After boiling, transfer this hot water into a different container, just to prevent your face from touching the hot container accidentally. Then add very small amount of mentholated topical ointments such as Vicks Vapor Rub or Gendu Balm or Ambutangen, and inhale the steam. Do this only for about 10 seconds, not more than that, maybe about 4 to 5 times within 5 minutes. If you do it longer than this, you can damage your nasal linings that are very sensitive to heat. Studies have not shown consistent benefits from steam or vapor inhalations in the treatment of common cold. But in my personal experience, this decreased severity of symptoms. So this is just a grandma's advice. Do not give this to children under 5 years of age, and remember to close your eyes when you inhale, otherwise it can damage your eyes. And the next tip, drink plenty of water, about 8 glasses of water per day. Without water, it's difficult for your body to get rid of the virus. How about some vitamin C tablets? When taken in small doses for prevention, it has some benefits. Studies said vitamin C given after the onset of cold symptoms didn't reduce symptom duration or severity. I would take vitamin C only when exposed to the cold, for sure, or when you have cold symptoms. But I would discourage you from taking it all through the cold season, like many people think. Mega doses of vitamin C were shown to give kidney stones and upset stomach and make you more prone for internal bleeding. Further studies are needed on daily recommendations of vitamin C supplements. Generously consume food rich in vitamin C such as citrus fruits, guava, broccoli, kale, chili peppers, spinach, and many more fruits and vegetables. Do not forget the most important sunshine vitamin, which is vitamin D. So keep your vitamin D levels therapeutic. To know more about the vitamin D supplements, please see my article on my blog. The next mouth-watering tip is something I made up. It is spicy tomato and garlic soup, because some studies shown cold symptoms were shorter in duration in people who took garlic supplements of about 180 milligrams of allicin, which is in garlic, for about 12 weeks compared to placebo. So I would love to eat tomato and garlic soup when I get cold. Let's talk about a popular botanical cold prevention, which is Echinacea. I never used it, but it was recommended as a supplement for 2 to 3 weeks when you think you're exposed to cold or when you think you will be exposed during travel. Though Echinacea is said to boost up immune strength when taken for a shorter duration, it was shown to suppress immune strength when taken for longer periods. So it's not a good idea to use it all through the flu season, just like vitamin C I told you. Again, herbal and botanical remedies failed to demonstrate beneficial effects for common cold. Last but not least is my favorite of all is probiotic. I believe probiotics will improve immune strength and decrease frequency of viral infections, but data supporting their use for cold prevention is limited. If your cold symptoms last for more than 10 days, or if you develop fever, or if you have ear pain, face pain, chest pain, or breathing trouble, throat pain, or severe cough, see your doctor. That could be a sign of secondary bacterial infection, which needs prescription medications. Please check my website, drsaila.com, drsaila.com, for more details on this topic and for the references. This information is based on my opinion. This is intended as sharing of knowledge and is not intended as medical advice or a substitute for your doctor's visit. If you need medical advice, always contact your own professional healthcare provider and do your own research. Thank you. That's it for today. Thank you for listening. And remember, as always, your health is in your hands.